All right. Thanks for being here this morning. Hopefully, we'll have another couple of folks join us. And Dr. Oka, I think you've sat through this before, so it will be very familiar to you, although I know it's
Okay.
been a year. But I'm going to walk through several things. I did want to introduce the staff. The office manager, Jessica Emmerich, is not with us this morning, but Melissa and Ashley are both on with us. And again, Dr. Oka, good to have you with us. So I'm going to walk through a real quick thing on the coalition, just briefly touch on our current policy goals, talk a little bit about advocacy, about why the oral health legislative awareness event is important, talk about preparation, about how your voice matters, a little bit on talking with legislators and some of the ins and outs of that. We're going to talk about our current priorities for the 2019 session, a little bit on the schedule and having to deal with kind of impromptu, a little bit on the coalition one-page item that we ask people to hand out for their visits. We will have copies up there. And then some pages on logistics, follow through, and a little note about surveys to follow. So we are a nonprofit advocacy agency with the mission of improving the oral health of all Missourians through sound public policy and public awareness. When we go up to the Capitol, we are doing both of those things because we typically have asks, as we do this year, around specific policies. And of course, we're raising the awareness by taking this public action about the importance of oral health. Our vision is that oral health is a high priority for all Missourians. We're trying very much to make especially sure that that is the case for policymakers, but we do other things to do that, make sure that the public is also thinking it is a high priority. We are best described as a statewide network of advocates working to improve Missouri's oral health through system change. So it's very important, I think, for people to understand this. That word coalition, it truly applies. We use the work of partner agencies, member agencies, and most importantly, individuals throughout the state to kind of press for change. It is not just the action of coalition staff that does all this stuff. It's everybody working together. These are our current policy goals. Many of them are unchanged from previous years. Of course, we have some goals that we accomplished and got pulled off because of previous work, such as reinstatement of Medicaid adult dental benefits. Of course, now we'd like to see it to be comprehensive, but we've added a couple of things, incorporation of oral health care and school-based health care. So there's a big move on in Missouri to try to expand healthcare into schools. There's actually an organization that's formed in the past couple of years to work on that. We just want to make sure that, again, oral health is not a forgotten part of that picture. Probably the most clinically oriented goal we've ever adapted is expanded coverage of and access to silver diamine fluoride for all Missourians. We have not had that listed previously. We're going to have a session on that at the conference. We don't have a bill currently to work on that, but we certainly are in the raising awareness stage and wanting providers in particular to know about silver diamine fluoride and how it works. The other goals I won't go through for right now because they've been around for a while. So I wanted to just say a couple of words about advocacy. This is, in fact, mostly what you're doing when you talk with the legislators. So at a really basic level, it's simply raising awareness about an issue that's important to you. Legislative contacts in particular show that it's important to you and to Missourians. So they have this idea that constituents care about this issue. That's kind of another level of advocating, whether you ask for anything specifically or not. Just having the contact saying, "Hi, I care about oral health," really matters. And then it can be about specifically requesting an action, such as passing a law, funding a project or program, changing a regulation, those kinds of things. It's very important that legislators know that oral health is important to Missourians and important to you. And oral health always suffers from this being easy to kind of forget about it. So it's really important that we have a presence and that the legislator hears that we're paying attention to that issue and hears that it's something that's important to Missourians. Then I just wanted to make a few comments about the event itself. This is really the only legislative event that we do each session as a coalition. Although many of our, as I know, Laura down there, many of our organizational members do take our goals to the Capitol. But the more people you visit, the greater likelihood that we'll have an impact. Because we have these pre-conference workshops, teledentistry in particular, there's a lot of interest in those areas with overlapping time. So our registration for the event is lower than it has been, which makes everybody who shows up very, very important. And, really the goal is just to engage with legislators as a constituent and a Missourian. Just to walk in there and say, I live and or work in the state and this matters to me, I think is very, very important and something that you want to get across to people. And it really does matter. It seems like such a simple thing, but it really does make a difference. And most importantly, and I think this is where that coalition word comes into play, unified voices are difficult to forget or ignore. And so everybody that goes up there, it makes a difference. There we go. So in terms of preparation, and I think Dr. Oka, in your case, we're pairing you up with someone, so I believe Melissa will get a schedule to you fairly soon. But you could look up the senator and representative on that list. Anybody else, we give it to you. And what you want to know are the committee assignments, what legislation are they interested in. You can find a lot by looking at their bio. We do not have any dental health professionals in the legislature now, which is unfortunate, but we have other people that are interested. And we'll talk a little bit more about them later. There's also a photo on their page with the House or the Senate, and you get a room number and a phone number, so you know where you're going and how to find them if you need to call. Believe it or not, legislators actually like to hear from concerned citizens and constituents. They will generally listen to you. I think even though we go in there with specific asks that are about now, I think it's always good to think about these contacts in terms of longevity. We have found legislators will reach out to people that they've met through a legislative contact on one of our events, and because they have a question about something and they connected a little bit with a person, and so they have an issue come up and they call and they ask, and that's important. Making those longer term connections will play out over several years and might become very helpful in certain instances. And I always want to say this to people: your voice as an individual citizen can actually carry a lot more weight than lobbyists or professional advocacy staff. Most legislators really appreciate it when they're hearing, from a person who isn't up at the Capitol all the time or isn't kind of regularly involved in the political process. That carries weight with them, and they will pay attention to you. So it's very, very important to make these. So some comments about talking with legislators. You obviously want to introduce yourself. Say that you're up there with the Missouri Coalition for Oral Health. Be sure to refer to legislators as Senator so-and-so and Representative so-and-so. Legislators expect that you will ask them to do something. They expect an ask. So it's a little atypical for most people to go somewhere and say, hey, can you do X, Y, and Z? But that's part of the routine up there. They expect that you will, in fact, do that. So nothing unusual about having an ask. You should expect interruptions. It is a it is a highly dynamic environment. It's noisy. You may have to wait patiently, even if you have a prearranged time. They may not be there. You may have to wait for them. Other things can happen, like they'll be in, even though it's not scheduled that way, sometimes they can end up in session at a time they're not supposed to be in session. And sometimes the LA will say to you, let me go get them. Come with me. And they'll pull them off the floor and you talk with them in the hallway. Legislators are very, very busy people. It varies greatly from day to day. Wednesdays tend to be really, really rowdy. Thursdays, not so much, but there's a lot of visiting groups throughout session. Sometimes you'll have, bunches of school kids up there running all over the place and other groups. So it can be a pretty overstimulating environment. You'll also find the floors vary greatly. The third floor tends to be really, really active. That's kind of the center of the universe up there. So it's much noisier there. Also, you have to be aware that legislators often have many issues in mind, and sometimes they will just talk with you about those things that have nothing to do with why you're there or anything to do with oral health or even healthcare. It's just because they're thinking about it. You might want to engage with them on issues that are not related to the coalition, but if you do that, we ask that you try to make it clear that you're speaking at that point in the conversation as an individual, not as a representative of the coalition. It's a little tricky to do that if you get into it. I think it's generally better to just wait patiently while they talk about their thing and then go back to your points that you were trying to get across. Okay. A lot of times people are disappointed because they didn't get to see the legislator. But talking with a legislative assistant or the LA or other staff, even interns, can be just as beneficial. Sometimes it's even more helpful because an LA is kind of the center of the world in those offices, and if they pick up on your issue, they'll make sure the senator or rep remembers your issue. So that's important to remember. A lot of people I wanted to talk to the senator, but you can't always make that happen. And spending a little time with that LA is good. You sometimes will get questions that you can't answer. Just note that on the feedback form. It's fine that you can't answer everything. Just tell them I actually don't know. It's really good to make a connection on a personal level. As I said, kind of that long-term thing. It'll make it that much easier if you ever go back to them to ask them to do something or ask them to vote a particular way. They'll be more likely to listen to you. Always be polite. Thank them for their time. Leave the priorities in the one pager. So we'll have legislative priority sheets and one pagers. I think we will also mail those to you ahead of time. And I'll be in the third floor alcove on the Senate side, and we'll have copies of these things up there. And it's always a good idea to leave your business card with them. So our 2019 priorities are really to thank them for funding Medicaid adult dental benefits. It's always at risk because it is an optional Medicaid, an optional part of Medicaid coverage. The state does not have to cover adults for dental. Um, and we'll give you a little bit more information about that on the priority sheet, but we want to be sure to say thank you, and we now know some of the impacts of that. We know that we have, since reinstatement in 2016, dropped use of hospital emergency rooms for non-traumatic dental care by 44%. That is a fantastic piece of information to have. It clearly shows that that was a good policy decision. That is also related to the opioid epidemic because typically people with dental pain that go into ERs do not get dental care, but they do get antibiotics and painkillers. And before adult dental was reinstated in Missouri Medicaid, they were told, go see a dentist. You're in bad shape. You need to get that taken care of. And they did not have the financial wherewithal, and they didn't have coverage. So they would go take the painkillers and the antibiotics and maybe get cleared up and then show up at the ER again. And that is a good way to get you hooked on opioids. So really good impact. We wanted to let them know a little bit about that. We're hoping that Senator Wallingford will hold a meeting of the Oral Health Caucus so the state dental director can go over there and talk in detail about all the data we have about the impact of reinstating Medicaid adult dental benefits. We do have a piece of legislation in two versions floating in the House and Senate. That's Senate Bill 278 and House Bill 975. 278 has already had its public hearing. We testified in favor of it, as did the MDHA and the MDA. There was no opposition, and I don't believe the committee has voted on that yet, but they may do that today or may have yesterday. I haven't had a chance to get online to look. House Bill 975 by Representative Swan from Cape Girardeau is the exact same language. It was filed last week, hasn't been assigned to committee yet. When you file two identical things, you have a better chance of getting it passed, and we've been fortunate both Senator Wallingford and Representative Swan have worked with us. This is the same bill that was filed as House Bill 2213 last year by Representative Lichtenegger, who is now former Representative Lichtenegger. She has been term limited and is no longer a representative. She did come up and testify in favor of Senate Bill 278 as well. So this is another piece of fluoridation legislation. It is trying to deal with this local decision-making process and make it a little bit more accountable, and specifically would require the local decision-making body, whether that's a city council, a county commission, or water board, or whatever version of government they're using in a locality, to get information from the local health department, so the county health department. And there is a county health department covering every area of the state. Not every county has a health department. Sometimes they contract with the next county over to do those services. But the local health department's the only local agency charged with assuring community health, and we feel that it's important that they have an opportunity to interject good science-based information to that process. It doesn't take the decision-making authority away. It doesn't make the decision-making body pay any attention to the local health department's information, but it will become part of the public record. And Dr. Dane's shop, the Office of Dental Health, will make sure that the county health departments get training and technical assistance, so it's not a burden for them. The Missouri Public Health Association has endorsed this bill, so that's good to have that as well. And then the third thing we want to mention again, although we have no traction around this, to be honest with you, would be increasing access by pulling up those Medicaid provider rates. Provider rates are very low, really don't recover costs, and remain relatively unchanged for many years. They were pulled up a little bit and then back down. And so many private practice dentists find it very difficult to get into the Medicaid business. They do it more for kids, adults. To be honest with you, in many cases, they really can't afford to do very much of that. The ones that do kind of try to control the volume. It's the FQHCs that provide most of the services to the Medicaid dental population. Access issues will never be beaten until we get the private practitioners back into the game. So that's why we want to put that on there and at least mention it this session. We hope to see an opening for actually moving that forward. State revenues are not looking real great. There's been this whole tax debacle. Apparently, Missouri's been collecting taxes in the wrong way. The federal tax law changes revealed that, and it's caused a whole problem. So the revenues are down, and it's just not a good environment in which to actually expect them to pull up provider rates. They do not have extra money. And we are watching to make sure that Medicaid adult dental does not get threatened by that loss of revenue. We think we're okay. We haven't heard anything negative about it. And they do have to vote to take it out now, whereas before, and back in 2016, they had to vote to put it in. So we think we're all right. The schedule, and just wanted to talk a little bit about impromptu visits. So Melissa is working on scheduling appointments for you with your senator and rep, and in your case, Dr. Oka, with your partner. Unless you told us that you take care of that yourself. Sometimes we have people that just want to do that. Again, even with an appointment, you might miss your senator or rep. Try to spend time with the LA or staff or intern, whoever they give you to work with. On the House side, it tends to be the LA. They have bigger staff on the Senate side, so you may get an intern or a staffer other than the LA. It's not unusual to go to an office at an appointed time and you find the door locked. Just walk around and go visit somebody else and come back a little bit later and try again. Again, I mentioned earlier the LA may pull the legislator off the floor to speak with you. They may even take you to a committee room. That's possible too. We usually don't have that happen, but that will happen, just to give you a heads up that you can have some variation. We probably will have you scheduled with other legislators also besides your home senator and rep. And we also will probably just have other names on your list for you to visit without an appointment. And that's perfectly fine. You can even walk into somebody's office that you don't have on the list. The other list are people who are on important committees, but I mean, really, anybody's fair game. Just walk in and introduce yourself and do your thing. But you probably, when you're completely unscheduled, you want to be especially polite and sure to thank them for the time. We will provide you a copy of the coalition one-pager. This can be left with each office along with the legislative priorities. It's a very busy one-pager. It's printed front and back and fairly small font. It's exactly what a lot of people say you shouldn't do, but we have found that it works well. The back page with all the logos establishes that there are a lot of organizations paying close attention to this issue, and the front page, even if they just read the bulleted larger font things, gets across it's an important policy issue. Oral health is poor in Missouri. We literally say that in the form, and it can and should be addressed by policymakers. And again, that it's a policy issue of interest to many organizations and individuals. There are a few legislators who will actually read every word on it. It's footnoted, so it's credible. I think most legislators will not take the time to read this, even though it's one page and in the back is basically logos. But it, that's that's how it works. It's still helpful. We do want you to leave a copy of it. Yes, so I will be on the third floor. This is a map. They call this the central area, the third floor rotunda. That's the big open area where all the lobbyists lobby, and there's frequently events out there. There's tables up and displays. Very, very echoey, noisy place. You'll see at the bottom of the image there's a thing labeled the grand staircase. That's that very large central staircase that actually doesn't get used much. And then up on the third floor, so that goes down to the big doors on the building that face the Supreme Court and High Street, not the river. The legislative library side, or the top of this page, is the river side. Can't see out of any of the windows right now because there's rehab being done on that building. But we are in the alcove. You'll see two red X's on there. We're on the alcove on the Senate side. That's sort of up above the grand staircase, and there's columns there. It's a little bit hard to see when you're just walking around until you go right by the opening to it. But that's where I will be. That's where the materials will be. It's noisy there as well. It's hard to hear. We end up kind of yelling at each other sometimes, depending on how many other people are around. And then every floor is kind of laid out with all of these rooms around the outside of the building. When I'm probably jumping ahead a little bit, but when you come in, you can take elevators up. They're marked on here. There are stairs as well, and you'll kind of come in down underneath that grand staircase, and you can turn right around and go up those other stairs that are marked and walk up to the third floor, either to your right or left when you come through security there, or you can go down the hallways and get one of the elevators and take it up to the third floor. Either way works just fine, depending on how much you want to walk. It is a good place to get your steps in. I will tell you that between walking to the building and then walking around the inside of it, there's plenty of walking to do. Just some of the other logistic stuff, I've mentioned a few of these things already, but the building is being renovated. I don't think they've actually started on the interior, but that's going to happen too. But the building is kind of tinted. They've got scaffolding all over it. If you haven't seen it, it's got a pretty interesting look right now. And you can only get in one place. It is underneath the grand staircase. Watch for signs. It is kind of on the house side of the building where you have to walk into the building underneath the grand staircase. And just watch for signs, and there is security in there that you will have to go through, similar to airport security. Parking is always challenging around the Capitol. It's even more challenging with this renovation going on because parts of the circle drive around the Capitol are closed off for construction equipment and all that. So walking up from the Capitol Plaza Hotel might be the easiest option. If you drive up to the Capitol and try to park a little closer. One, you may have trouble finding a place to park that's relatively close, and two, you'll really want to watch the signs about where you can park. There is a very small amount of free parking. I doubt that you'll get that. Some of the metered parking is only an hour. Most of it, what you'll find relatively close, is 2 hour. And don't expect the Capitol Police or the local police to cut you a break on a ticket. They're not very expensive, but they will write They will write you a ticket. They have there's a meter maid going up and down the streets all the time, and they're very vigilant, and they reliably ticket. There's no dodging them. If you go over your time in a parking spot, you probably will get a ticket. If you in the free parking, a lot of it's I think 3 hours right there by the Capitol. If you go over the 3 hours, they'll give you a ticket. They mark your tires and they know. So don't fool yourself into thinking you won't get a ticket. That being said, they're usually not that much money, but probably money you'd rather not spend. Uh, Again, enter the through the doors under the stairs on the south side, facing High Street, the Supreme Court, opposite the Riverside, and it'll be on the western side of the building or the house side. But you'll see signs as you walk up. That is kind of the corner of the building that faces Capitol Plaza. It's that kind of that end of the building that you enter from. Yeah, they make you empty your pockets and all that stuff. Everybody's kind of used to that. And then I mentioned you can take the stairs, to your right and left. You can just turn around when you come out of the security area and get staircase on either side, or walk down to the ends of the hallways there. There's bathrooms fairly close to where you come in, and there is an information desk right ahead of you, and they're usually very helpful if you have questions you want to ask. I'll be up there no later than 7:45. I'll be around for at least 90 minutes, probably longer, and I can answer questions. I can provide guidance. We'll have copies of needed material, but look for the material to be sent to you ahead of time. That'll include the priorities, the schedule of appointments for you, the coalition overview. We'll probably give you an advocacy one-pager. I don't know if I'll bring hard copies of that. We'll probably just send that out to you. Very important that you fill out the legislative feedback forms, because that way we know how many visits were made and with whom, and if there's anything that we need to follow up on, or just if you got a really interesting response, like you went to see some representative and they went on and on about how they hate Medicaid or hate dentists or something. I mean, we want to know that if we've got some hostile parties up there. We don't think we have anyone like that. We do have people who do not like Medicaid coverage or public coverage at all. We know that there's a few of them up there. The legislature typically goes into session at 10 a.m. There are often committee meetings before that. Some of them start at 7 in the morning. That's not unusual. Again, if you're enjoying what you're doing, you can go right on up to time to get back to the hotel for the conference. If you want to do that, you can. You will find doors on the third floor into the House and into the Senate. It's more typical on the House side, but you can actually go to that person and say, "I would like to see Representative so and so," and they'll see if they can pull them out for a second to talk to you if you'd like to do that. It usually works okay, and if they can't come out, they won't. Feedback's they're really important for us. So again, those forms get turned in at the desk at the Capitol Plaza Hotel. In terms of other follow through, a personal thank you note really will make a great impression. These people get tons of email. They get tons of phone calls. They don't get many handwritten notes. They just don't see it. And we have found people will read them and they'll remember you. If not the legislator themselves, the staff members. Whoever you visited with is the person you want to address. There are business cards in all these offices for them, so you can pick them up, and then this is how you write the honorable Senator so and so, the honorable Representative so and so, and the address. You just have to have their number Again, you can find addresses on the House and Senate websites. And if questions come up, drop us a line at info@oralhealthmissouri.org. We all try to monitor that email account. And there will be a survey link sent out. It looks like it might be a survey of one. And there'll also be some questions in the conference survey. And that's what I have. So I would be glad to take any questions.
Well, thank you so much. I appreciate your taking the time to do this. It's a very good refresher, but I really wanted to know what our asks were this year compared to last year, and now I know that, so that's very good. I'm really happy that the dental coverage, adult dental benefits have made a difference, but I wanted to know if how pregnant women are covered under that. Because as you know, in pediatrics, we're really trying to prevent our children from getting exposed to the bad bacteria that mothers carry in their mouth early. And I was wondering if there was a specific coverage for pregnant women, or they were just part of the overall.
Pregnant women have always had coverage through Medicaid in Missouri, even before adult dental, but there are problems with that, as I understand it, because they have to sign up for it, and that's where the breakdown occurs. Some people do not have contact with the healthcare system early on in their pregnancy, even though they should, and that, it's with pregnant women, it's more the provider side telling them, hey, it looks like you'd be eligible for this, and getting them to take care of that. And so, as I understand it, in reality, people don't always have the coverage that they're actually eligible for. And I think it cuts off fairly quickly.
Right. I suspect that, yes.
Yeah. Now, if they're otherwise eligible for Medicaid, in other words, eligible for Medicaid, not just related to their pregnancy, then they would fall under this adult dental benefit.
Okay.
The set of coverage for pregnant women for dental is more comprehensive, is my understanding, than what we have under adult dental. Adult dental does not cover crowns and dentures. But I think the populations that are already eligible do have more robust coverage.
Coverage, okay.
That being said, most people are pretty reluctant to get into much dental work while they're pregnant anyway.
Right, right.
But
Yeah.
and a lot of people think they shouldn't. A lot of people are misinformed and they think, well, I can't have any dental treatment while I'm pregnant, which is unfortunate.
Yeah, it is. Yeah, because we come across families, where mothers have bad teeth, and I try to encourage them to go in and just get that fixed as early after the baby as possible if they can. Some of them I realize they have to. Other people just don't do anything, and then I guess they lose the coverage or whatever. And those children are very high risk, and those children, the kids are going to come back at age 1 and 2 with bad caries. So.
Exactly. That's exactly where I was going to go. Is if you can get those mothers hooked up and they take care of that dental, it makes it that much more likely they're going to take care of their children's dental and,
Right.
and get into the dentist and hear the story about, oh, you should bring your baby in early
Right.
don't wait for the teeth to erupt. Let's
Right.
have them come, all of that. But unfortunately, that's where dental really does suffer because part of the a good part of the population thinks, as do a lot of decision makers, it's sort of this extra thing. I'll worry about that later. It's not that essential. And so they put it off and, there's some cost involved in it. If they don't have much money, they just prioritize other things and they don't do it. And the reality is it is essential to health, to overall health. And people just don't know that. And then there's another segment of the population that thinks that dental is all about straight
Teeth, yeah,
very white,
cosmetic.
shiny teeth. So it's kind of a cosmetic thing, and that
Right.
again undermines it as an essential health issue. It's
Yeah.
uh, it's tough to cut through that, unfortunately.
Right. And the last question I have for you, silver diamine fluoride, is that covered now through Medicaid or is that?
It is covered for children. And Melissa, do you know up to what age, or Ashley, do you know?
I am thinking it's 5. It
Okay.
Yeah,
might be higher.
I think it's 5 or 6. I think that's right.
Okay.
Dr. Dane managed to get that kind of slip through without too much fanfare.
That's great.
We hope to see that expanded, but then the problem is a lot of people don't know about it. A lot of dentists don't know about it, and then there are some dentists who are not in favor of it. We think we've taken it up as a policy issue because it's inexpensive, it's easy, it doesn't involve numbing or drilling
Yes.
or any of that, and you do get a black mark on your
Right.
tooth, but especially on children's teeth. For a relatively inexpensive procedure, you can set them up then to have much better permanent teeth when they come in, and
Right.
not to live with anything painful.
Right.
So we think it's great. We think it's applicable for the senior population too, who can't afford dental care. Black mark's a lot better than pain. And
And
some
pain.
dentists, yeah, and some dentists will uh, treat the cavity with SDF. It always needs to be checked again because apparently it doesn't work 100% of the time. Sometimes there's a reapplication. Sometimes for whatever reason it just doesn't seem to work at all. Pretty rare as I understand it. But some dentists will go back in after they've seen the SDF has arrested the cavity.
Mm-hmm.
And there's some remineralization, in other words, the tooth has gotten hard again,
Right.
and then they'll cover it with tooth-colored bonding material.
Uh,
Again, no drilling, no no numbing. They can just do that typically without too much of a hassle.
yeah.
The
Especially
And
for the
I did
babies.
just,
Go ahead.
right. I did just double check. Reimbursement for silver diamine fluoride is for age 1 through 5
That's great.
yeah,
currently.
yeah, it's kind of a secret. We're hoping after this conference, people are far more aware of that coverage. And I'll just say as an aside, we have had some conversation with Dr. Dane about expanding that coverage. We're kind of not positive how to, the kind of the best way to go about addressing that issue, but we do intend to push on that at some point to try to expand that coverage. It's kind of a no-brainer in many ways because it's so inexpensive.
It is, and
So
also, kids don't have to go under anesthesia for that too as well. But
yes,
yeah, so with all the costs and complications, so it's really something I hope will catch on. We as pediatricians would love that. And the
yeah.
kids I
Well,
know don't like the black marks on their teeth. Maybe the older school age kids might not, but the younger kids, I don't think they care.
no,
Yeah,
they don't.
yeah.
They don't care, and I'm sure you've seen some of these kids come in with their mouths full of caries on
Oh,
their
we see a lot
baby
of that.
teeth.
Yeah, we're
Yeah.
really trying to prevent it. We're doing better in primary care, but even then, I know, and I brought this up. I'm sorry, I don't know if you have time. You have to go on something. I have a few more minutes. Do you have to leave? I just
No,
have
it's
one
fine.
one quick question.
Sure.
Um, uh, at a meeting I was attended the AP meeting conference last November, where there was this dentist from, I guess it was in Florida, who said that the percentage of patients who received fluoride varnish in primary care in Missouri was pretty low compared to other states. He had this graph, and we were all very, very, very way at the bottom. So we have a long way to go in encouraging our primary care providers to provide fluoride varnish and bill for it in the office. We have a long way to go. That's
Yeah,
what his stats appear to show.
yes. I think some of that data is probably lagged a little bit, although our numbers aren't great. But Dr. Dane would have a more complete picture of that.
Okay.
We do bring that out because the national sort of official numbers are the national official numbers, and you know, that's sort of the truth. Dr. Dane knows a little bit more, and they've actually worked on getting those fluoride varnish numbers up.
Oh,
So
okay.
there is a lot of work being done. I do, however, think you're right that we don't have primary care physicians doing that, and they can, but it's not happening in their offices. So there's a whole potential for expanded use of fluoride varnish, and it would be very helpful to do that. So I totally agree with you.
Okay. Thank you.
Yeah. Well, Melissa or Ashley, did I leave anything out, or do you just want to take this time to spread some idle rumors?
I think you covered it well. Dr. Oka, as Gary mentioned, we will be sending out materials, for the handouts, the schedule. We will also send out the links if you want to look into the representatives and senators that you're scheduled to visit. I do have someone I'm going to pair you with. Her name is Ronnie Gochi, and she is with Hope Dental.
Okay.
She's in the Independence area. And but I don't have her full 9-digit zip code yet.
No problem.
So, but I think she's the only other person kind of in your area. So I think it would
Okay.
be a good fit for you two to go
That's good.
together.
That's fine. Thank you.
So you're welcome. But yeah, we'll send all of that out, either possibly tomorrow or on Monday.
Okay.
Would be my kind of my timeline here. I have a few more calls I need to make with legislators for visits, and then it'll be ready to go.
Hey, thank you so much.
You're welcome.
All right, sounds good. It sounds like we're at the end. And Dr. Oka, I wanted to say I was delighted to see that you had registered for the conference again, and very pleased to have you with us this morning. It's ended up being a private technical assistance meeting with you, but that's fine. We're building from our strength, so
Yes.
we're happy to have you here.
Yes, and I'm looking forward to see you all next week too. Take care.
Yes, we
Yes,
will. We
thank
will see you
you.
then. Thank you so
Okay.
much.
Okay. Bye now.
All right.
Thank you.
Bye-bye.
Bye.
Bye bye.